Hey, my name is Luke Schellenberger. I'm an ENT doc. So pretty commonly, I get questions about the adenoids, most of the time from parents. A lot of times, parents will ask, well, are the adenoids the cause of my child's snoring? Or are they the cause of my child's blockage in the nose and constant stuffiness or constant drainage? And so I want to talk a little bit about that. So number one, what are the adenoids and where are they? Adenoids are part of the lymphatic system. The lymphatic system is part of the immune system, kind of the trash bin of the body. They get bigger, they get inflamed when we have infections or inflammation. The adenoids are between the nose and the throat. They sit in an area called the nasopharynx. Nose, pharynx, throat. And I'll have a video here in a minute about them, showing you kind of where they are on me. And so in that area, if the adenoids are really big, well, they block up the nose. And we definitely can see this in younger kids. In the 1-year-old, 5-year-old crowd, most frequently, sometimes in that little older age, but before adolescent crowd, very rarely in adolescents or adults. So when they get big, they can cause 3 major issues. They can cause the Eustachian tubes to be stuffed up and blocked up. So the Eustachian tubes lead from the space underneath the eardrum down to the back of the nose in that nasopharyngeal area. And if the adenoids are really big, they can block that up, and they can cause the Eustachian tubes to be non-functional, and they can cause recurring infections. In fact, routinely, if kids are coming in with recurring infections, especially if they've already had one set of tubes and we're looking at a second set, our criteria says that we should look at the adenoids and assess if they're enlarged or inflamed. The second reason why that they can cause is they can block up the back of the nose, and you can have nasal airway obstruction. So again, in that younger crowd, that 1 to 5-year-old, 1 to 10-year-old crowd, if they can't breathe through their nose, we definitely will want to think about the adenoids playing a role in that. And then finally, if the adenoids just stay chronically infected, what's called chronic adenoiditis, it can mimic chronic sinusitis. And so whereas an adult who has chronic sinusitis will routinely want to look at the sinuses themselves and get a CAT scan and things like that. And whereas in younger kids, we want to more focus on the adenoids because they're it's a lot more common that that's the problem. The sinuses are a little underdeveloped in that very young crowd, and so a lot of times we'll more focus on the adenoids. Of course, parents a lot of times ask, well, you're going to take these adenoids out. Is my child going to have more problems? And the answer is not usually. Now, you don't take adenoids out for no reason, but really research has showed that removal of adenoids doesn't necessarily lead to more infections. In fact, if they're chronically infected and inflamed, it leads to less, because that's kind of areas where the bacteria kind of can hide and basically stay infected, kind of like the tonsils in chronic tonsillitis. So that's kind of a little bit of where they are, what they do, what happens if you take them out, and why we would think about taking them out. So I'm going to show a video now of my adenoids. Well, I really don't have much of adenoids, but kind of my nasopharynx, and show you how the adenoids are related right beside that opening of the Eustachian tube. Okay? So I'm going to do what's called a nasal endoscopy or a nasopharyngoscopy, basically looking at my own adenoids and my own nasopharynx. Now, I don't have huge adenoids, but I can at least kind of demonstrate to you where they are and kind of their relationship to the nose and to the throat. Okay? So here we are in my nasal cavity. We're just advancing back to the back of the nasal cavity. So on this side of the screen over here, this is the Eustachian tube opening right there, okay? So you can see where the Eustachian tube is. And as we go back, this is where the adenoids are. Again, I don't have very large adenoids, But if they were very large, they could block up the eustachian tube, and we're at the back of the nose, they can block both sides of the nasal passage up. So that's where the adenoids would be if they're very large. Now, obviously, we don't do a lot of nasopharyngoscopy in young children because, understandably, they would be very disappointed at this point in time. But we routinely do it in adults to look at this area. For example, if an adult patient had a nasopharyngeal cancer, we'd routinely want to look at this area and see, has the cancer come back? We also routinely look at this area if an adult has fluid underneath their eardrums. That's not very common, but we'll routinely look at the nasopharynx saying, like, wait a second, is there something in the nasopharynx that is causing this fluid to build up in this underneath that adult's eardrums? And so we need to assess what the nasopharynx looks like to see, is there something blocking there, or the eustachian tube openings very inflamed? So we've just shown you a nasopharyngoscopy, shown you where the adenoids are. We've talked a little bit about those, so go from there.